If you are an allergy sufferer, we don't have to tell you that allergy season is here. Pollen counts are high and your symptoms are kicking in. But there's also a lot of crossover with COVID and allergy symptoms. 7 News on Your Side talks to a MedStar doctor to clear it all up.
Runny nose.
This is George Fleming from Prince George's County. You can see it in his eyes.
Like your head is floating, like in water.
For 20 years, he has dealt with terrible allergies.
What's the worst part of allergy season for you?
The worst part I would have to say would be the headaches.
This year is no different. In fact, it seems to be worse.
The headaches have been intense, and the pressure.
Last year, he had to make sure his allergies weren't COVID.
I actually did go to my doctor just to be certain. I was like, let me check, let me make sure. It's the normal sinuses and it's not nothing else.
His doctor, Maria Elena Ruiz with MedStar Washington Hospital Center, says Fleming is not alone.
One of the issues with COVID is it can have a myriad of symptoms, lots of different symptoms, so it can be a little confusing.
So here is Dr. Ruiz's simple guide.
Allergy symptoms are more like wet symptoms, runny nose, runny eyes. I would think as COVID is more dry, if that's maybe an easy way to remember it. So COVID tends to have a dry, non-productive cough. And also, people feel short of breath.
7 News is on your side with the differences. Allergies usually come with irritated, itchy eyes, runny nose, scratchy throat, and sneezing. COVID often has fever, shortness of breath, extreme fatigue, body aches, dry cough, and loss of taste or smell.
At what point do you have it checked out?
I would advise all allergy sufferers to be proactive, to try to start taking their medicines and avoid the things that trigger their allergies. I think that I would recommend that patients with allergies kind of monitor their symptoms, take their temperature, and if there's any concern, reach out to your primary care provider.
And the same goes for your kids because they can really grow in and out of allergies. But if they have a fever, get it checked out, or if the symptoms get worse over time.